So this is Steve Boldrick with OMT Talk, and today we're doing a cervical eval. And I figured for all those of you that follow the blog, it might be worthwhile to see what I do in the clinic with a live patient. And so today we have Christian with us, and he works with me, and recently has had some sort of and so I'm just going to run through what I normally would for a neck eval. I'll do a scan exam, we'll do some PIVMs and sort of assessing accessory motion, and then hopefully get into treatment so you can see how I take sort of an eclectic approach to mixing pain science and current best evidence with manual therapy practice. So, all right, so Christian, give me the rundown on what has happened over the last several weeks that's led to this neck pain.
Well, it kind of started with a trip. I felt it on a plane flight, basically, and it's just been like creeping up my neck. I can feel it in my traps a little bit, but then it goes all the way up to the top of my head, the back of my head right here.
Okay.
And it just feels like it's like gripping it, and almost like a whiplash feeling. It was that's when it was the worst on the plane.
How long was the plane?
Plane was 6 hours.
6 hours?
So yeah, it was, and then that whole trip, it was kind of, so basically that whole 3 days it was killing me. And then it went away, and it's been firing back up like once, a few times a week. Like this week's been really bad. So it definitely went away for a while, but I've been feeling it again.
And it kind of just comes and goes at will. Now, prior to that plane ride, anything out of the ordinary that you did those days preceding or weeks preceding that plane ride?
No.
And you've flown before, I assume.
Oh yeah.
And you never had neck pain. So, you know, thinking back to that flight, I mean, was your neck kind of were you crouched between two other passengers and like really kind of limited on space? What about that flight that you can remember? Was it did it come out of the blue? Was it 2 hours into the flight you started getting pain?
It was before the flight that I felt it. So I could feel it going into the flight, because I remember I was thinking this is going to be a bad flight with my neck hurting like this. I did sit in the middle, and it wasn't uncomfortable. Like I was kind of squished, but
so it started before you actually boarded.
Yeah.
Okay. Were you particularly stressed at the time? Any weightlifting or any exercise prior to that flight? Like maybe a really tough workout
the day before. Okay. Yeah. I mean, I work out consistently, so.
Any like shrugs that you remember that you were doing the day before?
No.
Okay. And with this, are you getting any headaches? What kind of rules in an upper cervical involvement, kind of cervicogenic headache type?
I had a headache yesterday.
Okay.
That's the only time I've had one that felt like back in here.
Okay.
So that's the only one.
And any referral of symptoms into your arms at all?
I feel it. I can feel it going down back into my back, kind of like a top through my traps, and almost down in here.
Okay. Any numbness and tingling in your arms, or weakness, or lack of power when you're doing your lifting?
No.
So kind of looking at if there's any fatigable weakness or any sort of motor neuron involvement that would impact his function. So there's nothing there. Okay. How do you do with sleeping? Does it bug you with sleeping?
No, doesn't bug me with sleeping. Only that headache did, but.
Okay. Are you a back sleeper, side sleeper?
Side sleeper, stomach sleeper. Yeah.
Okay. When you're on your stomach, you get your head turned to the side quite a bit. Okay. You don't wake up with neck pain?
No. It comes in throughout the day. It gets worse through the day. Yeah.
Any change like when you're doing computer work?
No. Sometimes I try to pay attention to it and keep it back so I can feel it, but it's not like something that's nagging at me, I guess, when I'm doing computer work.
Now I've seen you two around the clinic, like you try to stretch it and stuff.
Yeah.
Is that what you're trying to do, to try to self-medicate a little bit?
Yeah.
Okay. Nothing else, you're not trying heat, you're not trying ice. You're still working out to the same capacity you were before.
Yeah, I've kind of taken this week off. I've only worked out once this week.
Okay. And any pain while you're working out?
Towards the end of it, I'll feel it, even on the only time I don't feel it is leg days. In the upper body at all.
Okay. All right. Cool. anything else? Medical history-wise, I mean, I would assume you're a pretty healthy guy. You're not
Yeah.
taking medications for anything.
Mhm.
No, any previous car accidents, previous sporting incidents with your neck?
The only thing I've ever had with my neck was I got whiplash from a bike wreck when I was like 12.
Okay.
That was it.
Okay.
Yeah.
Okay. And with your baseball activities, you never gotten hit by a pitch? Or?
No.
Okay. All right. And when you were a young kid, maybe you remember, maybe your parents have told you, did you have any like chronic upper respiratory tract infections at all?
Like.
Like coughs, and, a lot of really
Yeah.
snotty kid,
Yeah, I used
Like
to
what?
get strep throat a lot.
Okay.
Yeah.
So for those of you, I asked that special question in part because there's a known link between chronic inflammatory exudate from upper respiratory tract infections in an adolescent. Essentially what happens is that inflammatory exudate can degenerate or affect the upper cervical ligaments, and that's known as Grizzle's syndrome. And so we'll definitely be taking a look at upper cervical stability, especially if I'm going to elect to do any sort of manual therapy or manipulation on him too. I'll definitely be checking that just to make sure that we're safe like we all should be. So anything else you can think of?
No.
No? Okay, cool. Well, I'm going to stop the video. We're going to set it back up.